Patrick C. Walsh, Dr. Patrick Walsh's Guide to Surviving Prostate Cancer. Embark on a journey to understanding and addressing prostate cancer with Dr. Patrick Walsh's Guide to Surviving Prostate Cancer. This book summary delves into the different risk factors, prevention methods, and treatment options for this widespread disease. As we reveal the importance of early detection and adopting a healthy lifestyle, expect to uncover recommendations to limit your risks and opportunities to make informed decisions regarding treatment alternatives. Empower yourself with knowledge from this guide, allowing you to face prostate cancer with confidence, resilience, and an optimistic outlook on the future.
Prostate cancer, risks and prevention. Prostate cancer is a significant concern for men, especially in Western countries. Key factors that influence the likelihood of developing the disease include age, African descent, and family history. While these risks cannot be altered, adopting healthier lifestyle choices, such as maintaining a healthy weight and quitting smoking, can help reduce the overall prostate cancer risk. Embrace a well-balanced diet rich in vegetables, fruits, grains, low-fat dairy, and proteins to further minimize your chances. Prostate cancer is a genuine health concern for men, particularly in Western countries like America. In fact, a boy born in the United States today faces a 12.5% chance of developing prostate cancer and a 2.6% chance of dying from it. Given these statistics, it's essential to understand the risk factors associated with the disease. Age plays a significant role in your likelihood of developing prostate cancer. The disease takes time to develop and often doesn't manifest until later in life. Men over 70 are nearly 7 times more likely to face the illness than those aged 50 to 59. Individuals of African descent also possess an elevated risk of prostate cancer, with the highest chances of both developing and dying from the disease globally. Family history can additionally contribute to prostate cancer susceptibility. Although it may not always be hereditary, shared lifestyle habits among relatives could increase one's odds. While you cannot control factors such as age, ancestry, or family history, adjusting your lifestyle can help reduce your risk. Excessive abdominal fat can elevate the chances of developing prostate cancer and hinder recovery if diagnosed with the disease. Additionally, smoking does not directly cause prostate cancer but amplifies the likelihood of a deadly outcome and diminishes the success of treatments. In conclusion, the recipe for lowering prostate cancer risk involves quitting smoking and opting for smarter food choices. Implement a wholesome diet abundant in varied vegetables, fruits, grains, low-fat dairy products, and proteins to further decrease your chances. Early detection of prostate cancer. Prostate cancer can be deceivingly silent in its early stages, which is why it's crucial to prioritize early detection. Men in their 40s are encouraged to speak with their doctor about undergoing a PSA test and a rectal examination. If the PSA level is high or a lump is detected, a biopsy will be performed to determine if it's cancerous. Upon diagnosis, patients will closely monitor their PSA levels and learn about their Gleason score, a system that grades cancer aggressiveness, and the clinical stage of the cancer, which can range from nearly non-existent to having spread to the lymph nodes or bone. Armed with this knowledge, patients can explore their treatment options. Tailoring prostate cancer treatments. When it comes to prostate cancer treatment, the best approach is personalized and considers a variety of factors, such as age, tumor grade, health, and personal preferences. Instead of seeking a one-size-fits-all solution, individuals should explore various treatment options based on their unique circumstances. Active surveillance, for example, can be a viable choice for less severe cases, but regular monitoring remains crucial, as cancer's unpredictability may require prompt action. Unraveling the complex world of prostate cancer treatments can be overwhelming. Instead of looking for a universal solution, it's essential to recognize that the treatment's effectiveness hinges on personal circumstances. Factors influencing treatment options include the tumor severity and grade, age, and overall health. Personal preferences play an equally important role in deciding the pathway forward. For instance, some men may opt for surgical removal of an almost benign tumor to alleviate the worry, while others may choose a less invasive technique to minimize stress. Another important consideration is age. An elderly individual may not benefit from aggressive treatment and its potential side effects. Imagine a situation where a cancer diagnosis reveals a low-risk, non-aggressive, and relatively small tumor. A common strategy in this case is active surveillance, which closely monitors the tumor's progression with the possibility of initiating treatment if circumstances change. An apt representation of this approach comes from Ronald Reagan's quote, "Trust, but verify." Though it might appear counterintuitive not to eradicate the cancer immediately, trusting follows the evidence-based medical viewpoint that some cancer cases may never require treatment. However, the nature of cancer necessitates the verify component, regular checkups and testing to keep a vigil on possible changes. In some cases, good fortune may lead to cancer remaining stable while living a fulfilling life. However, when the severity increases or the cancer stage advances, it becomes indispensable to take necessary action. To conquer prostate cancer, it's crucial to understand that treatment is highly individualistic and align one's plans based on unique needs and preferences. Radical prostatectomy breakthroughs. Imagine battling the mythical Hydra, only to have more heads grow back each time you sever one. Prostate cancer similarly produces 3 to 7 tumors on average. Thankfully, radical prostatectomy can effectively eradicate prostate-confined cancer. This gold standard approach minimizes negative side effects like impotence and incontinence when executed by an experienced surgeon. Suitable for healthy men with a 15-year life expectancy or longer and curable cancer, radical prostatectomy avoids unnecessary surgery for terminal patients. Advancements in technology, such as laparoscopy and robotic-assisted 3D sensing cameras, ensure minimal damage to surrounding areas, preserving urinary control and sexual function. Remember, the success of such procedures ultimately relies on the surgeon's expertise in performing this potentially life-altering operation for younger, healthy men. Exploring less invasive cancer treatments. Radiation therapy and cryo or thermal ablation offer less invasive cancer treatment alternatives to surgery. Radiation therapy, including its variation brachytherapy, utilizes radiation to target and destroy cancer cells while sparing healthy tissue. Although prone to causing fatigue and potential long-term side effects, the method exhibits remarkable accuracy and precision. Cryo or thermal ablation involves heating or freezing the prostate, providing a more manageable experience and fewer side effects. It is a fairly new treatment that still requires comprehensive comparison to surgery and radiation therapy, and it may not be as effective in eliminating cancer, but may be recommended in particular cases where tumors are larger or cancer has returned post-radiation therapy. Factors unique to each patient should guide the selection of the most suitable treatment method. Hormone therapy explained. Hormone therapy is an essential treatment for metastatic prostate cancer or when the cancer has spread to other parts of the body. Its primary function is to shut down the hormones that feed the prostate, which can either be done through surgery or medication. Though hormone therapy can be effective in reducing symptoms, it is not a cure for cancer and will not increase a patient's life expectancy. The treatment can have profound side effects like loss of sexual drive, reduced muscle mass, and bone thinning, affecting a man's physical and emotional well-being. Consult a doctor to understand the consequences of this treatment option before opting for it. Prostate cancer, cure and hope. The journey to curing prostate cancer entails early diagnosis and effective treatment, ensuring that the cancer hasn't spread beyond the prostate. Post-treatment, regular prostate-specific antigen, PSA, tests are crucial to monitor the potential recurrence of cancer. While side effects such as erectile dysfunction can be distressing, treatments are available to restore sexual function. Maintaining an optimistic attitude and staying informed about the latest advances in prostate cancer research is essential in overcoming challenges and embracing a hopeful future. With timely diagnosis and appropriate treatment, prostate cancer can be cured when confined to the prostate. Monitoring prostate-specific antigen, PSA, levels post-procedure is an essential aspect of the healing process, as undetectable PSA levels a decade after surgery indicate a low likelihood of prostate cancer mortality. Although erectile dysfunction is a common side effect following surgery or radiation therapy, it can be treated effectively, and most men regain sexual function. Aside from the physical aspects of treatment, an equally critical component of recovery is embracing hope and optimism. Prostate cancer treatment and research are continuously evolving, with new clinical trials and therapies emerging as promising hope carriers. Ultimately, facing the future with confidence and courage is essential, as there's always room for hope and progress in the fight against prostate cancer. Remember, you are not alone, and giving up is never an option.
In conclusion, Dr. Patrick Walsh's Guide to Surviving Prostate Cancer effectively demystifies the risk factors, detection, diagnosis, and treatment options for this prolific disease. It emphasizes the value of early detection and maintaining a healthy lifestyle, especially for those with higher risk factors like age and African ancestry. The book also dives into different treatment choices, weighing up the pros and cons of surgery, radiation therapy, cryo and thermal ablation, and hormone therapy, ultimately calling for personalized and informed decisions. Retaining a positive outlook and staying up to date on medical advancements is essential in overcoming any challenges, and ensuring the best possible outcomes in the battle against prostate cancer.